Our first didactic presentation is called TB Echo World TB Day Epi Presentation. It's coming to us from Kelsey Houston, who's an epidemiologist for the TB program at the Washington State Department of Health. She started working in TB in January of 2021 after graduating from the University of Washington MPH program. She primarily works with the Washington Disease Reporting System, or WDRS, and program evaluation metrics. She lives in Vancouver, Washington, and in her free time enjoys traveling, trying new restaurants, and spending time with her two cats. Kelsey, thanks for giving the didactic, and take it away.
Great, thank you. Let's see. Can you all see my screen okay?
Yeah. Great. Yep, we can see it well.
Great. Thank you. Hello, everyone. My name is Kelsey Houston. I'm one of the epidemiologists with the tuberculosis program at the Washington State Department of Health. And today I'm going to be providing an overview of tuberculosis epidemiology in Washington State, national and global data as well. At the end of this presentation, there's going to be a slide containing contact information for the Washington State TB program, should you have any follow-up questions. Thank you for your participation today. I have nothing to disclose. Our objectives for this presentation are to review global, national, and statewide TB data as it relates to public health work, to highlight possible opportunities for collaboration in TB elimination, and to use state TB epidemiology data to identify populations at risk for LTBI and TB disease to improve timely diagnosis. Before we get into the data, I wanted to share a quick reminder about why we are meeting today. World TB Day is observed each year on March 24th. And as you all know, World TB Day was last week, and we appreciate you joining us this month and throughout the year to discuss TB together. The Stop TB Partnership 2025 World TB Day theme was Yes, We Can End TB, Commit, Invest, Deliver. It conveys a powerful collective message of hope, urgency, and accountability, emphasizing that TB elimination is achievable if we take concrete actions. Our meeting today is the final in a series of TB Echo sessions dedicated to World TB Day, and we thank you again for joining us and for your partnership in working towards TB elimination together. So let's start off by reviewing some global TB data, and we will zoom in from there. The information you will see on the next few slides was taken from the WHO 2024 Annual TB Report, which provides an up-to-date assessment of TB at global, regional, and country levels. Here we see global incidence rates per 100,000 population from 2010 to 2023. Here I'm specifically speaking to the green line and shaded area, which represents all TB cases. Since 2010, there has been an estimated slow decline in the global TB incidence rate, with slight increases since 2020. These increases can be partially explained by the after effects of disruptions to TB services during the COVID-19 pandemic. And the TB incidence rate is estimated to have increased only slightly between 2022 and 2023 by 0.2%. And WHO suggests that the global rise in the number of people becoming ill with TB that started during the COVID-19 pandemic is starting to slow and stabilize, and that most of the increase in cases from 2022 to 2023 reflects population growth. This WHO world map shows that TB occurs across the globe and that rates vary among countries. And countries in darker green have higher rates of TB incidence compared to countries in lighter green. And this is a reminder that TB is a global disease, and any global increase in TB is likely going to reflect national and also Washington State increases. So that was a little bit of global data emphasizing that TB is a global disease. And next, let's zoom in to look at national data. When available, this data was taken from the CDC Provisional 2024 TB data, noting here that the information is preliminary and subject to change. And when 2024 data was not readily available, data was taken from the CDC Reported Tuberculosis in the US slide set for 2023. And I'll be sure to call out any changes in time frame as we go through these slides together. After nearly 3 decades of consistent decline in TB in the United States and a large decline in 2020, the TB case count and rate began increasing in 2021. As I mentioned in the global slides, this can be partially explained by the COVID-19 pandemic. In 2024, the United States reported 10,347 TB cases and an incidence rate of 3 cases per 100,000 persons. This case count and incidence rate are higher than in 2019, the year prior to the COVID-19 pandemic. There's a lot of work to be done to reach the TB elimination threshold goal of less than 1 case per 1 million persons, which is approximately 335 cases per year for the current US population. This map shows that TB occurs across the US with rates varying from state to state. Darker purple represents higher incidence rates. 12 states and the District of Columbia had higher incidence rates than the national rate of 3 cases per 100,000 persons in 2024, all highlighted here. You will see that there were 4 states highlighted in yellow, including Washington, and these states were below the national rate last year in 2023, but above this past year in 2024. And in recent years, Washington State typically trends with the national TB rate. So we tend to blip on and off this map, some years at, above, or below the national rate, which we're going to explore later in the presentation. This slide shows TB cases by age group over time from 1993 to 2023. Noting here, we've changed the time frame. Every age group saw an increase in cases when comparing 2022 to 2023, with those aged 25 to 44 having the largest increase in cases. And the largest percentage of TB cases in 2023 occurred among persons 25 to 44 years old, followed by persons aged 45 to 64 and 65 years or greater. Here we see the percentage of TB cases by sex and age group. Again, here we're looking at 2023 with males on the left and females on the right, starting with age group 0 to 4 at the top and working down to the age group of 65 and older. As in previous years, males represent the majority of persons with TB disease overall, accounting for 62.3% of TB cases in 2023. And this trend holds true for all age group listed here using unrounded numbers. This slide shows TB-related deaths and mortality from 1993 to 2022, which is the most recently available data. There has overall been substantial improvements in TB-related mortality and incidence rates. The National Vital Statistics System reported 565 TB-related deaths, or 0.2 per 100,000 persons, where TB was the underlying cause of death in 2022. This is a 6.1% decrease in deaths and a 6.5% decrease in the mortality rate compared to 2021. This slide highlights contact identification, or CI, efforts in the US from 2018 to 2022, and this is the most recently available contact identification data at the national level. This data was taken from the CDC 2022 RP Contact Investigation Report. From 2018 to 2022, 92.7% of patients with smear-positive TB disease had contacts elicited with an average of 13 contacts identified per case. 1.2% of contacts evaluated via CI were determined to have TB disease, and 16.2% were determined to have LTBI. Among those determined to have LTBI, 76.1% initiated LTBI treatment and 80% completed treatment. I wanted to highlight the importance of treating TB infection, as 1 in 10 people with latent TB infection will go on to develop TB disease. I've included a link on this slide to CDC's Think, Test, Treat campaign. And based on this data here, of those who start treatment, roughly 80% will complete and hopefully be prevented from continuing to TB disease. And contact identification is a crucial part of TB elimination work. And King County will be speaking about one of their CI efforts in the next presentation. But first, let's take a look at some Washington-specific data. This data was pulled from our surveillance system on March 11th. Note that the data is provisional and subject to change. This graph displays reported TB disease cases for the last 31 years in Washington State. The bars indicate the case count for each year. From 1993 to the early 2010s, Washington saw a fairly consistent decline in TB cases. However, in the past decade, there has been a lot more fluctuation and a reversal of this long-term trend. In 2020, there was a significant decrease in cases, 163, followed by significant increases in 2021 and 2022, with 199 and 251 cases respectively, then a drop again in 2023, 218, and this past year in 2024, Washington State counted 257 cases of TB. This is the highest TB case count Washington has seen since 2007. There are several factors that likely influenced recent TB counts, including COVID-19, a Department of Corrections outbreak, and other TB clusters. This slide shows TB case rates over the last 31 years. The solid blue line represents Washington rates, the dotted purple line represents the US rate, and the dotted gray line represents the target case rate for 2030 and the goal of TB elimination. Over the last 31 years, incidence rates of TB in Washington have progressed downward overall. Historically, Washington has been below national rates, but in recent decades, we have trended with the national rate, some years below, at, or above the national rate. More recently, there was a significant decrease in the TB case rate in 2020, followed again by increases in 2021 and 2022, slight drop in 2023, and an increase this past year. Like we previously discussed, these recent fluctuations in case rate can be partially explained by the impacts of the COVID-19 pandemic, an outbreak in Washington correctional facilities, and a few other TB clusters. In 2024, the TB case rate in Washington was 3.2 cases per 100,000 persons, and the US case rate was 3 cases per 100,000 persons. The National Tuberculosis Indicators Project, or NTIP, has set a 2030 target of 1.48 cases per 100,000 population, and both Washington and the US are consistently above this target. This map illustrates average TB case counts over a 5-year period from 2020 to 2024 in Washington counties. Counties in darker blue have an average of more than 10 cases of TB reported per year. Counties in teal have an average of 5 to 10 cases of TB reported per year, and counties in light blue have less than 5 cases of TB reported. We've included average case counts for Snohomish County, King County, and Pierce County to differentiate the counties with more than 10 cases. Snohomish County had an average of 27 cases, King County 104, and Pierce County 26 cases from 2020 to 2024. You may notice here that very few Washington counties are shaded in gray, which represents counties with no reported TB disease cases over this time period. TB disease occurs in most areas of Washington and is more concentrated in urban areas. However, it's important to call out that even one TB case in a local jurisdiction represents a lot of public health work, including case management support and contact identification efforts. This slide shows TB case rates by age group and sex at birth. Males are shaded in yellow and females are shaded in blue. From 2020 to 2024, higher case rates of TB were experienced by males compared to females, similar to the trends seen nationally. Over the same period, when stratified by age group and sex as presented here, males aged 65 and over experienced the highest case rate compared to all other groups at 5.4 cases per 100,000 persons. Please note that TB disease in children under 5 years old may be an indicator of recent transmission. And there are many risk factors to consider when thinking about TB in Washington. This slide shows the prevalence of select risk factors among Washington TB cases from 2020 to 2024. And when we talk about risk factors for TB, these can be risk factors for being exposed to and infected with TB, or they can be risk factors for progressing from TB infection to TB disease, noting here that individuals can fall under more than one risk category. From 2020 to 2024, Washington residents born somewhere other than the US accounted for 72.5% of TB cases in Washington. TB is more prevalent in certain parts of the world other than the US, and therefore risk of exposure to TB is greater for people in those areas. Roughly 30% of Washington TB cases born outside the US during this time have been in the US for more than 20 years prior to converting to TB disease. An individual can have LTBI for many, many years prior to developing TB disease, which again highlights the importance of thinking TB and thorough contact investigation. Certain medical conditions can lessen the ability of the immune system to keep TB infection from progressing to TB disease, and diabetes is one example. 23.4% of TB cases in this 5-year period had a diagnosis of diabetes at or before their diagnosis of TB. During the same 5-year time period, 13.1% of TB cases in Washington were a known contact of a person with infectious TB within 2 years prior to their TB diagnosis. Like the first risk factor mentioned here, this relates to a greater risk of exposure to TB. 5.2% of cases during this time reported experiencing homelessness in the year prior to their diagnosis. In congregate settings can increase likelihood of exposure to TB. And 5.1% of TB cases during these 5 years reported excess alcohol use, which can impact the immune system and therefore is a risk factor for progressing from TB infection to TB disease. And these are just a few examples of risk factors for exposure to TB and progression from TB infection to TB disease. And this slide highlights contact identification, again, or CI, efforts in Washington State from 2018 to 2022. I've also included the national numbers in the yellow boxes from the previous slide that we reviewed together. From 2018 to 2022, 98.3% of patients with smear-positive TB disease had contacts elicited, with an average of 20 contacts identified per case. 1.5% of contacts evaluated via CI were determined to have TB disease, and 16.2% were determined to have LTBI. Among those determined to have LTBI, 77% initiated LTBI treatment, and 87.3% completed treatment and were hopefully prevented from progressing to TB disease in the future. When comparing to national numbers, you might notice that Washington has more contacts identified per case, and this is definitely influenced by the Department of Corrections outbreak, which had a larger contact identification effort. And here's some new data to look at. This slide shows the number of counted TB cases in Washington identified during contact identification for another TB case. This is new data, so we only have 2 years to look at. In 2023, 32 or 14.6%, and in 2024, 28 or 10.9% of TB cases counted in Washington were identified through the CI of another case. This further highlights the importance of conducting thorough CIs, since in addition to identifying LTBI, you may find TB disease cases and be able to prevent future exposures and potential transmission. Here we see TB mortality in Washington. TB is treatable and curable, and in Washington, most people with TB disease successfully complete treatment. Among TB cases diagnosed in Washington from 2020 to 2024, approximately 7% of patients died before diagnosis or during treatment, and about 5 of the 7 deaths were attributed to TB disease or TB treatment. Early and accurate detection of TB is important in reducing TB deaths in Washington. And in summary, 1, TB disease is a global disease, and rates of TB vary from country to country. 2, Washington typically reflects national TB trends, as we saw with case rates. 3, TB disease occurs in most areas of Washington and is more concentrated in urban areas, although even 1 case represents a significant workload for local jurisdictions that don't have as many patients with TB. 4, TB disproportionately affects vulnerable populations in Washington, as we explored on our risk factors slide, where we saw that spending time outside of the US, certain medical conditions, and time spent in congregate settings, such as homeless shelters, are examples of risk factors for increased exposure to or progression from TB infection to TB disease. And 5, contact identification efforts are crucial to work towards TB elimination. Identifying and treating patients with LTBI help prevent future TB cases. Which then leads us to our next presentation on a CI in King County. But first, I quickly wanted to share our contact information. Feel free to drop any questions in the chat, or you're always welcome to email us at our TB services inbox. We'll get back to you. Thank you for being here today and for letting us share this information with you.